This is my supply of THC pills. I have just completed 1 year as a holder of one of Missouri's medical marijuana cards provided to me through my doctor. I believe that in the past year I have taken only 5 or 6 of these capsules. I'm not a cancer patient, I don't have glaucoma, and though I may be guilty of causing anxiety and panic attacks in other people, I do not use marijuana for my own panic disorder. I sometimes suffer from sleep disturbance, and when a warm bath and a bowl of cereal or music and meditation cannot help me fight my way through the insomnia, I've found that a marijuana, specifically an indica capsule, will gently help me to go to sleep. Over the years, I've tried several prescription sleep medications, but all of them have terrible side effects, at least to me, that make me very hesitant to use them. Medical marijuana has been a very happy solution for me that allows me to break up my insomnia with no noticeable side effects. I don't smoke pot, and having given it a couple of tries over the past few years, so far as I'm concerned, you can just dig yourself a great big hole and put all the bud in the world in it and cover it up. I don't want to get high. I don't like it. In the same way, while I sometimes drink a beer or enjoy a nice aged rum, I don't want to get drunk. Alcohol is a potentially dangerous drug, which has ruined the lives of millions and millions of people over many centuries. Perhaps as many as 35 million Americans are active alcoholics, which translates into a lot of drunk driving, unemployment, destroyed families, and very serious health problems and shortened lives. Like fried chicken or salt-cured country ham, alcohol can be an occasional treat, but too much of it will kill you. I did my master's thesis in the treatment of alcoholism. I've worked in the VA addiction treatment program. I have dozens of funerals in my past for people who have died from alcohol abuse or alcohol-related car accidents or alcohol-related suicides. I've gone into the homes of alcoholics to wrestle a gun away from an intoxicated and abusive spouse. I have seen the seamy underbelly of alcohol, and so I always treat it with respect, just as I do my car. An automobile is very useful. In many ways, you could say it's necessary, but it's also a dangerous machine, and it could kill me, it could kill others, especially when combining cars with alcohol. About 28 people die every day from drunk driving automobile accidents, more than 10,000 a year. Again, speaking only from personal experience, I've done a lot of funerals over the last 42 years, but I've never done a funeral for someone who died from marijuana abuse. Still, it is possible to mess up your life or your family's life with pot. I personally know people who are addicted to it, smoking or eating it several times a day, having it before breakfast, wake and bake, never let that time in the afternoon, 4:20, go by without smoking, and then have to smoke in the evening. The people I know who are addicted to marijuana are not simply forgetful or irresponsible. They are also not about to hold down a job, and I will never again let one of them pick me up at the airport to give me a ride home. Heavy marijuana use makes people make bad decisions. It makes them easily distracted. And while being high is not the same thing as being intoxicated, there are a lot of similarities. It does create some law enforcement headaches. For example, alcohol, curiously enough, is the only drug that you can get a blood test taken when you've been pulled over by a patrolman, and it can fairly accurately tell you how intoxicated the driver is at that moment. That isn't true with marijuana. THC stays in your blood from a day to 2 weeks, so that even a sophisticated blood analysis cannot tell you how high that a marijuana user is at any given moment. In states that have legalized the use of cannabis, it's now forcing the police to do field sobriety tests, leaving it up to the arresting officer to determine by their own judgment how impaired the driver is, which is probably why more black and brown people are arrested for impaired driving with marijuana than white people, even though statistically, white people smoke a lot more pot than black and brown people do. Still, last year in New York City, 90% of marijuana arrests were people of color. That's got to be wrong. Now, you may not want to believe that the police are more harsh in their judgments of people of color than they are white folks, but the math makes it pretty clear that they are. If you don't believe it, may I suggest that you're just not looking at the evidence. You are choosing to not believe it as a part of our built-in white privilege defense that we white folks do unconsciously. I'm not going to argue this point because, dear white people, in your heart, you already know that I'm right. If you're a regular listener, you know that I've talked about this before, about how the Nixon administration turned Johnson's war on poverty into what the Nixon administration called a war on drugs, which very quickly became a war on the poor, if not, in very fact, an all-out war on people of color. The Nixon administration realized that there were drugs that were specific to the anti-war, anti-Vietnam groups and the Black Civil Rights Movement. And by ramping up arrests and incarcerations of people who used those drugs, he was able to remove a great deal of the leadership of both the Civil Rights Movement and the anti-war movement. Still, 50 years ago, early in Nixon's war on drugs, he commissioned an in-depth study of the drug. Nixon appointed Republican governor of Pennsylvania, Raymond Schaefer, and Schaefer and 8 other members of the commission, along with a research staff of 76 researchers, produced a 4,000-page long report on marijuana. Now, mind you, this was a study commissioned by a conservative Republican administration that was hiking up arrests and incarceration periods of time for people arrested with marijuana. And it was done 50 years ago when there really had not been very much research done into the drug. In fact, a regular listener pointed out to me that I had not referenced this rather voluminous report in a talk I gave a few years ago about the war on drugs, and my initial reaction was admittedly a bit incredulous. Why would I reference a report commissioned by Richard Nixon 50 years ago, when Nixon was the one who was using pot as his excuse to jail Vietnam War protesters and leaders in the Civil Rights Movement? But 1971 was very different from 2021, and dare I say, Republicans were different in 1971 than they are today. This report, even 50 years ago, emphatically encouraged lesser punishments for marijuana charges. The Schaefer Commission report said, even then, that once you start to fund a budget for keeping people in jail, the profit motive quickly takes over any judicial reasoning, and it becomes nearly impossible to reduce the number of arrests and incarcerations once the system is dependent on the income. The report points out, dominant among the opponents of change who testify before legislative panels are the recipients of public funds, police chiefs, prosecutors, and drug abuse experts, all of whom are funded by government contracts and grants. The commission reported that cannabis was as safe as alcohol and recommended that it be decriminalized for public health reasons. This was in 1971. Now, Nixon ignored the report, but it wasn't far off from a very accurate report. It's not that far off from what I'm saying today, except that I believe that alcohol is much more dangerous than pot. Not harmless, but nowhere near as harmful as distilled spirits. As we used to say to our clients in the VA treatment center, if you drink a lot of beer, you need to understand you drink a lot. Beer is not a safe substitute for bourbon. Vaping is not a safe substitute for cigarettes. Don't believe the marketing. But long after Nixon was out of office, the war on drugs has continued to serve two vital purposes. It fuels the profits generated by incarcerating the people who were arrested, and it removes a portion of what at the time was understood to be excess labor in America, while putting them into virtual slave manufacturing camps. I've often said that the real secret behind Victoria's Secret is that those delicate female undergarments for years were sewn together by inmates. Now, I'm not going to go down that rabbit hole today, but you simply would not believe how many American corporations are dependent upon nearly free labor from prisoners, including dozens of major clothing and food industries. If the label says "Made in the USA," don't assume that you are supporting American labor. You may be supporting the prison slavery industry, which is basically funded by our tax dollars. We pay taxes to house, feed, and clothe them and provide medical care, and then corporations have them working long days at something like 25 cents an hour. We have 2 million people incarcerated in the United States, a larger percentage of our population than any other nation on earth. And yet, even though half of them are incarcerated because of drug charges, our drug problem is worse than ever. Just this past month, in November of this year, we crossed a horrifying Rubicon where in a 12-month period of time, 100,000 Americans had died of an overdose. Now, I realize that statistics can just kind of slide across the clean wax floor of our brains without leaving any muddy footprints. I realize that we are in the middle of a global pandemic, and we've had 400,000 deaths last year and more than that this year. Even with the vaccines, we've had more deaths this year from COVID-19 than we had last year. But we get COVID reports in the news over and over and over, every day, in the newspapers and televised news, in the podcast, we get updates about COVID-19. But overdose deaths, which is a fourth as many, 100,000 a year now, we hardly hear it mentioned. Somehow, we have become so inured to this death rate that it's no longer newsworthy. In fact, more people die of drug overdoses than the total number of Americans who die from gunshot wounds and car accidents added together. It's noticeable that our current death rate from drug overdoses, is 5 times what it was when this silly war on drugs started. What else do you need to say to prove that it's not working? These are not the best practices. In fact, in the last 12 months, we've had more drug overdose deaths in America than we had combat-related deaths in every war America has been involved in for the past 70 years. In 1 year, we've lost more people than we lost in Vietnam, Afghanistan, Iraq. Clearly, the war on drugs, say it with me, has been a complete disaster. It's wasted billions of dollars, and it has resulted in the deaths of hundreds of thousands and the incarceration of millions. But do you know how many deaths from marijuana overdoses there have been? None. 0. Do you hear me? It is nearly impossible to fatally overdose on cannabis. It can be done, but you have to eat it and you have to be astonishingly stupid. You can overdose on Tylenol, but not marijuana. Most of these 100,000 deaths this year were from fentanyl, OxyContin, methamphetamine, or other opioids, including prescription drugs used by millions like Adderall and Desoxyn. Again, as tempting as it is, I'm not going to let myself fall into this rabbit hole today. But let me just say, we have about 90 million Americans who are taking Adderall for ADHD. A third of our adult population is taking what is, men and women, the legal prescription form of meth. Your kids having difficulty focusing in school? Here, let's give them some meth and see how they do. Only recently, there's been research on the relationship between people taking Adderall during the day and then drinking alcoholically at night to try to go to sleep. I've only seen articles in the press about this over the last year, but I could have told them 10 years ago. I've done funerals for people who died from this lethal combination, and I expect that I will be called upon to do more. And yet, Adderall is now an $11 billion industry every year, and it keeps growing. If this doesn't make you mad, then I can only conclude that you're not listening, and that makes me mad. You should check your moral indifference, because we are living through a pharmaceutical nightmare. Even though we have a huge problem with drug abuse in the United States, including a death rate that has doubled in just the last 2 years during the pandemic, but none of those deaths were from marijuana. And yet today, we still have 40,000 people incarcerated on marijuana-related charges in our county jails, mostly in our state prisons, but also some in federal prisons. And because there have been so many for so long, we now have 70 million people who have criminal records for life based on these marijuana charges. Criminal records that follow them everywhere, preventing them from getting many jobs or starting some businesses. You can't get a liquor license if you're an ex-con. You can't obtain a decent business loan, and many home loans are not available to you. Sometimes even student loans are not available to you. And that's a third of the adults in the United States. They may not tell you about it, but you know a lot of people who have a criminal record from marijuana charges. And yet most of the people that I know who are daily marijuana users have never been arrested for it. They don't have a criminal record. So if 1 in 4 or 1 in 3 Americans have at least one arrest for a marijuana-related crime, and most of the people that I know have never been arrested, when do we get to start talking about marijuana use as a part of the human condition rather than a crime? If nearly everyone is doing it, and more than half of Americans have at least tried it, and that's by their own reporting, that's not even factoring in how many of them are lying about it because their parents aren't dead yet. American businesses are right now screaming for people to come back to work. 40 years ago, we were incarcerating what we thought was excesses in our labor force. We have no excesses in our labor force now. Businesses are dying to hire people. And it wouldn't solve the problem, but I can tell you where you could get 40,000 of them today if you would just let them out of jail. And millions more if we would purge the criminal records of these people who have not, in any reasonable context, committed a crime. And I hope you're listening to me. We have 100,000 overdose deaths in the USA in the past year. And we have an economy-killing shortage of employees. Restaurants are closing more days a week. They're closing earlier, while 70 million people are fighting against decades-old marijuana charges, and another 40,000 are languishing in our jails for offenses with weed that has no casualty count and is many times less dangerous than your favorite brand of beer or distilled spirit. Politicians often disappoint me. But I have to tell you, in 2016, in the closing weeks of Barack Obama's term in office, I really expected him to pardon the people who were in prison on marijuana charges. I expected it so much that I woke up early every day and listened to the news, waiting to hear about it. Obama had been a pot smoker himself, at least during his college years, and who knows when he really stopped. He's a smart guy. He has at least shown discernible signs of compassion. Never enough to suit me, but that's another story. But why didn't he hand out pot pardons like candy in his last weeks in office? 40,000 families will have an empty chair at their Christmas dinner next week because politicians can't get their act together to stop pouring money into the prison system and keeping, admittedly, mostly dark-skinned people behind bars. If this doesn't make you mad as hell, then I'm going to have to assume that there is a cold, hard place where your heart's supposed to be. If politicians are determined to keep the prison population up, how about letting people incarcerated for pot go free and replace them with the corporate managers at Kraft and Amazon who are criminally abusing their employees, or the doctors who shamelessly prescribe all of these opioids to people who don't need them so that they can take big pharma-funded continuing education trips to Hawaii every year. There are people who are really dangerous to society who need to be locked up, but it's not the pot smokers. They're just trying to remember where they left their glasses. Now, just so you know, almost no one gets charged with simple possession. A couple of years ago, I regularly visited an 80-year-old pot grower from Bolivar who was in our county jail. He later got a 10-year sentence in a federal prison, not because he was growing and selling a modest amount of pot on a very crummy farm that he had, but because when he was arrested, he had a rusted-out shotgun in the trunk of his car that he didn't even know was there. And that, ladies and gentlemen, somehow made him a gangster who was nearly blind, could barely walk, and you and I are still paying federal taxes to keep him in prison. Do any of you feel safer? And folks, before you could go to any one of the many dispensaries right here in Springfield, Missouri, before they were here, where did you buy your pot? Almost always from a friend, right? Among the people who use marijuana products, there's always sharing and trading going on, which makes it look like commerce, when in fact, it's just an underground distribution system created by the stupid laws that make it illegal, in the same way that Prohibition created the mafia in the early part of the 20th century. So even though prosecutors will try to tell you that these 40,000 people that are still incarcerated are dangerous, like my old friend with the rusted-out shotgun, it is the laws that create the crime, not the people who are trying to cope with the nausea created by their cancer medication by smoking some pot. While these 40,000 people languish in prison and 70 million are trying to get jobs in spite of their criminal records, 39 states and the District of Columbia have legalized marijuana, and another 5 have legalized medical marijuana, and I'm one of the ones that has one of those medical marijuana cards, and I don't mind telling you, not hard to get. Have a little trouble sleeping, and bang, I've got it. So basically, pot is legal in 44 states. So what states are the holdouts? Which states have the geniuses filling their state legislatures that are making the decision to continue to put these people in prison? Do you want to imitate Texas, Kentucky, Kansas, Mississippi? Do you think these states are full of people that are devoted to the best scientific research and the best medical practices? Really? I have a two-step modest proposal that will cut the federal budget, liberate prisoners, help solve the employment problem, stimulate the economy, reduce crime, and fill state and municipal coffers with new tax income revenue. I can only hope that President Biden is listening. We should immediately reclassify marijuana and regulate it and tax it exactly the same way we do beer. And secondly, Pharaoh, let my people go. Release everyone in prison on pot charges and wipe the criminal history of the millions of other people who've been found guilty of what we have to admit that we have known since Richard Nixon and leisure suits were in the White House. This is a bogus criminal charge. Or, being who we are, may I quote the prophet Amos, "Let justice roll down like waters, and righteousness like an ever-flowing stream." Thanks.
Thank you for watching our videos. We are entirely dependent on the donations of our listeners and members. We hope that you find this content to be important enough to help us to keep offering these videos to the public at no charge by becoming a regular contributor. Please click on the donate button on our website at www.spfccc.org. Thank you for your support of progressive religious programming.